So you help the team work with the doctor. Elaborate
Yes.
on that. What does that
Yes.
mean? And why is that so
Oh,
important?
so important. You know, I think there's a misconception, or I had this when I worked for people, that I just thought the doctor was supposed to be good at leadership, that they were supposed to know how to manage people. And now when you understand what you go through to be a doctor, being in that position and learning leadership is very different. So oftentimes, doctors are trying to find a way to give leadership to their team or give them what they need. But because we never talked about how we communicate together, sometimes they don't do it so well, or
Okay.
they don't do it from our perspective.
You
And
teach the doctor how to give better meetings
I
in a
teach
way?
the doctor how to give better meetings. I teach the doctor how to give critical feedback better, but that's not the only piece. That won't work in just that context.
Mm-hmm.
I teach the team how to understand that. I'll give you a quick
Yeah, tell me
example.
about that.
When I was growing up, I grew up in an Italian household. I don't know
Okay.
if you're familiar with, but my father, I came home, he was the,
Right.
he's that kind of
Yeah.
thing. And then he gave you a hug. My friend Maggie, she came from a household. Her father was very soft-spoken. He was very flat, right?
Mm-hmm.
And so Maggie would come home from me, and my father would be there. And Maggie was scared to death. She thought we were in trouble all the time. I would go to Maggie's house, and her father was giving me direction, Randy, and sometimes I didn't even know it. I'd come home, and my mom would say,
Interesting.
"What are you doing at Bob's?" It was like, what? I didn't know. He didn't deliver the message the same way. So it's interesting in a team, what happens is we all come to the table with different understandings of what things mean and the way we give feedback.
Mm-hmm.
And that gets in the way. And I help a team come together on understanding that so that when a doctor needs to come and say, let's say, for example, it's you, they're in the middle of a surgery, there are things that are happening and stressful, when they need to come say, Randy, I need this and I need it right now, they don't have to worry about you getting stressed. And you don't have to worry about whether he's mad at you about something. You're able to disconnect
So there's
that.
a lot of that going on.
There's a
within
lot of that
practices.
going on in practices.
The dentist says something the wrong way.
The wrong way.
Somebody receives it. They're pouting all day for a couple of days.
They feel injured. They feel injured.
So you fix that. You work on that.
I work on that. I think the ability to give and receive critical feedback is the number one barrier to success.
Interesting.
It's
Good.
the number one. When you
So
can
you
learn to
teach
get
the
information.
doctor. I just want to make sure I get this correctly. So you're helping the doctor
Yes.
and the employees, but helping the employees or the team understand the doctor better
Oh, yeah.
and their direction.
Oh, and when they understand each
So
other
they
better.
receive it better.
Oh, yes.
Really? Okay. Good.
Yes. And he understands them better. And he's able to listen to them better. The doctor, they could use to listen to their team a little bit more and understand them better too. And so, it's interesting. We have all these different pieces of equipment in our office, like lasers.
Mhm.
Lasers are great, right? They buy a laser. They figure out how to use it. And if they have two lasers, they figure out how to use each laser, don't they? So, I mean, maybe if we gave the same understanding to how we work together as we do with how we use our materials, we might be better in practice.
I have a dental friend.
Yes.
He goes, Randy, I was in the military. And he goes, what drives me crazy is where I come from, you tell somebody to do something, they do it. They don't sit around and question you all day long.
They don't sit around and question you.
So how do you teach? So what's your response to that?
Well, I'll give you my response to that right there. In the military, they break you down and form a culture or an environment where you understand that that's what it is. That's what you do.
Okay.
And so if you look at, that's why that works. But if you go into a practice of people where you haven't done that, that's not going to work. So you've got to organize in
So
your
the dentist
practice.
is the problem in that case.
Yes, yes.
And you tell them?
I'm comfortable helping them
Okay.
see things differently, I'll say that.
So his expectations are too high in that particular case.
Sometimes they're too high.
Like he has to be easier, maybe.
He has to be easier. And you look at it as a dentist clinician, especially one of the things I see sometimes, the more a clinician excels, the more they're in dialogue and debate and CE, the more they expect team members who haven't had that exposure or experience to process it in the same way as they do. And it's not the same. We've got to be able to connect somehow.
So you're like the relationship counselor in these meetings. So you do your 3-day course saying,
Mhm.
look, folks, when the doctor says this is what he means. And
Yes.
when you react and get upset, don't take it personally. So you're also teaching them how to receive the information.
I'm teaching them how to receive the information.
And you're teaching the doctor also how to maybe deliver it
Deliver
better
it.
or
Yes.
softer?
Yes. And so it's really a combination of both, isn't it?
Interesting. So it seems very complicated.
It's really,
Do you have a knack for it?
I have a knack for it. And it's simpler than it seems. I think it's our own discomfort and our fear that makes it seem so big. But if you look at it, it's what everyone wants. A great place to work, or a place that people drive to work, they want to feel good about what they do.
Okay.
All right. If they want to feel good, but nobody drives to work thinking, "Ooh, I want to be awful today. I can't wait for that." Right?
Okay.
So when you look at poor performance in an organization, it violates everyone's personal values. So if one of the number one currencies, we get paid to go to work, right?
Mm-hmm.
But one of the number one currencies that keeps us together is feeling good about what we do together. About, do we all come to work and feel good that we bring value to the table, that we make a difference for people? And so, you see practices, sometimes people leave over 50 cents an hour. And I don't think it needs to be that way.
Somebody wants to get started with you, you offer a free consultation.
Right.
Okay.
They get started with me. I offer a free consultation. After they have some discussion, if they feel like they're interested, then I put together a plan for them.
How
I
long
send
is
a
that? Like an
proposal.
hour on the phone?
It's an hour on the phone.
And do you ever get excited, like you're listening to them going, boy, this is going to be easy?
Oh, you know what? It's never easy, but you listen to people, and sometimes it's that what I feel is, oh my goodness, here's this person that's living in this environment, and it could be so much better. And in fact, sometimes I'm listening to them, even if I haven't met them, and I can see them later happier at work. And in the end, when you look at it, we are here for the patient. Every patient wants to believe that when we sit down in front of them and serve them, we're on our best day ever.
Good.
So I see them better and happier, but what I see is, in the end, I'm serving all those patients. I want to make clinical care better through my work.